Hi blog readers and followers. This is my friend and hero. He's shown me how to use a groundbreaking device to help train and carry grocery bags. As you can see, he has incredible artificial intelligent legs that enable him to walk better than 99.9% of the population. I truly admire him. And here I am, using my devices on my hands. Unfortunately, due to surgery, my arms don't work properly anymore, which is why I rely on these amazing hooks he taught me to use. When I look back, I realized that the policies and procedures in my case were nothing more than my surgeon's personal opinion. Before the surgery, he told me that if I didn't go through with it soon, my arms would eventually stop working. He even said, if it were me, I'd go through surgery myself. After the surgery, when I showed my surgeon all the problems I was having, the pain, the lack of function, and the obvious complications, his response was not a clear plan, not a proper procedure, not even accountability. Instead, he simply told me, I think you have lupus. You need to see your GP. That was his version of post-surgery policy and procedure. No safety measures, no structured follow-up, just an offhand guess that completely ignored the damage already done. These hooks allow me to pull everything I need, making everyday tasks manageable. It's all about adapting and overcoming. Now, let's get started. I want to share more about our journey and how technology can help us overcome challenges. Why I created this website. I created this website for patients and future patients in the healthcare world. It's a safe place for people to share and discuss their experiences, both good and bad, with medical treatment. It's also a space to explore and talk about advanced and alternative medicine or surgical options available in other provinces and countries. My goal is to create honest conversations that help patients learn, connect, and make informed decisions about their health. I have an important question for my blog followers and for Alberta's healthcare system. But before I ask it, I need to share a few stories and examples to help it all make sense. I want to share my story with you. I was a patient in our healthcare system who went in for ulnar and medial nerve surgery. But things didn't go the way they were supposed to. After the surgery, I found myself unable to properly use my hands and arms. The electrocauterizing tool that the plastic surgeon used ended up damaging soft tissue, and it caused lasting nerve injury. When I turned to my healthcare provider for answers and support, I expected care. Instead, I was met with silence. No meaningful help. That's when it became painfully clear to me. Something is broken in the plastic surgery side of our healthcare system. But there's something I do understand very well: safety. In Alberta, safety comes first. Employers with more than 20 employees are required to have what's called COR certification, Certificate of Recognition. To earn it, companies have to go through a detailed audit and score at least 80%. And why is that important? Because the entire purpose of COR is to save lives and prevent harm. Policies, procedures, standards, all designed to protect people and to make sure safety is never compromised. Now, here's where my story connects back. If safety and accountability are so critical in workplaces and industries across Alberta, shouldn't our healthcare system be held to the same standards? In the next part of my story, I'll share some of the most important elements of a strong health and safety program, and why I believe they must be part of healthcare too. Industrial radiography. Core companies must have strict policies and procedures in place for industrial radiography due to the potential risks of radiation exposure. Employees performing radiographic testing must be properly trained, certified, and licensed according to provincial and federal standards. Policies must ensure that only authorized personnel enter areas where radiography work is being performed. Employers are responsible for providing protective equipment, shielding, and monitoring devices, such as dosimeters, to all workers involved. Procedures must be established to monitor, record, and limit radiation doses to workers, ensuring they remain well below regulatory limits. Companies are required to perform hazard assessments before any radiography work begins and put controls in place to protect not only workers, but also the public. Emergency procedures must be written and communicated clearly, so employees know exactly what to do if a radiation incident or equipment malfunction occurs. Above all, employers must ensure that workers are never disciplined for raising radiation safety concerns and are encouraged to participate in continuous health and safety improvements. Example: industrial radiography, gamma X-ray. Industrial radiography is a powerful tool used in the oil and gas industry to take X-rays of cracks in pipes. Because it involves gamma rays, employers must enforce strict work procedures and ensure that everyone on the job site understands the hazards. Gamma rays are no joke. They can kill cells or permanently alter them for life. This makes radiography extremely dangerous if mishandled. If an employer misled a worker or failed to properly warn them of the hazards and control measures, and an incident occurred, the employer could face criminal charges. That's how serious accountability is in industry. Now, let's compare that to healthcare. Here's where my question begins. Why does Alberta Healthcare allow plastic surgeons to create their own policies and procedures for patients? In my case, the surgeon's policy and procedure was simply based on his personal opinion that my surgery would take 6 weeks and I'd have full recovery. Why would Alberta Health Services allow a doctor to use a tool that can alter or even kill human cells without clear hazard warnings, procedures, or patient safety policies in place? Why would Alberta Health Services permit a plastic surgeon to use such a dangerous tool without requiring documented safety procedures to inform patients of the risks? And why would Alberta Health allow post-surgery policies and procedures to amount to nothing more than a guess? In my case, I was told, "I think you have lupus. You need to see your GP." That was the follow-up policy. Learn more about electrosurgery. If you'd like to understand more about how electrosurgery tools work and why they can be so dangerous when not used with proper safety procedures, I've added some educational videos on this website. These videos explain how cauterizing tools, electrosurgery, affect human tissue and cells. I encourage you to watch them so you can see for yourself why strict safety standards should be in place in healthcare, just like they are in other industries. The big question for blog followers: if industrial workers, welders, or radiography technicians face strict safety standards, audits, and criminal accountability for failing to protect workers from hazards, why should surgeons and Alberta Health Services be held to anything less when it comes to protecting patients from medical tools and procedures that can permanently damage or alter human cells? Final question to blog followers: do you think Alberta Health is allowing doctors to mislead patients about the outcome of their health and body function simply because of poor policies and procedures? I've asked my questions. Now I want to hear from you. If you'd like to explore more on this topic, take a look at the article from the American Society of Plastic Surgeons on cauterizing electrosurgery. It highlights just how serious this tool really is and why strict safety standards should always be in place. Electrosurgical channeling is an unwanted and potentially dangerous phenomenon where electrical current becomes concentrated and travels through narrow, highly conductive tissue paths, causing damage at unintended locations. It is distinct from the surgical goal of narrowing, which refers to a deliberate and controlled procedure, often using electrosurgical devices to reduce the size of a passage or opening. Channeling is a complication that can occur in monopolar electrosurgery, where the current follows a path of least resistance through the body. The risk is highest when treating an area with a narrow stalk or base. How it happens: during a procedure, the electrical current may concentrate as it passes through a constricted, conductive area of tissue. This is especially risky in structures with a high water content, such as blood vessels and nerves.